Today we're unpacking one of the most debated and misunderstood comparisons between two major countries. How do the healthcare systems of the United States and the United Kingdom really compare? If you're planning to move abroad, weighing health costs, or simply curious why Americans and Britons have such different experiences with healthcare, this video will give you a clear and practical breakdown. We're going beyond slogans like free healthcare or private system. We'll explain how these systems actually work, what they cost, how people access care, and what this means in real life. 1. The big picture, public versus private models. Let's start with the core distinction. United Kingdom, the NHS. The UK's National Health Service, NHS, was founded in 1948 and is based on three principles. Healthcare should be universally available, free at the point of use, funded through general taxation. The NHS provides free doctor visits, hospital care, surgery, maternity services, emergency care, and most treatments. Prescriptions carry a small fixed charge in England, currently around $9.65 per prescription in 2025, but are free in Scotland, Wales, and Northern Ireland. United States, a primarily private system. The US has a largely market-driven system. There's no single national healthcare service for the entire population. Most people under age 65 obtain coverage through private health insurance, typically via an employer or individual purchase on healthcare exchanges. Medicare covers seniors 65 plus. Medicaid covers some low-income individuals, and the Veterans Health Administration serves veterans. In the U.S., medical care is delivered primarily through private hospitals, clinics, and practices, and patients are billed for services often with co-pays, coinsurance, and deductibles, even if insured. 2. Cost to individuals. UK residents. No monthly premiums for healthcare. The NHS is funded by taxation, so everyone contributes indirectly through income tax and national insurance contributions, NICs. There are no charges for GP visits, hospital stays, surgery, A&E, accident and emergency treatment. Only modest charges apply for prescriptions in England. Dental care, subsidized but not free. Eye care, also subsidized. U.S. residents. Most Americans pay monthly insurance premiums averaging $7,500 per year for single coverage, over $21,000 per year for family coverage in 2025, often split between employer and employee. Deductibles the amount you pay before insurance kicks in, often several $1,000s annually. Copays and coinsurance out-of-pocket expenses for visits, tests, and medications. Even insured Americans face significant out-of-pocket costs. Uninsured individuals pay the full retail price for services, which can be extremely high. 3. Access to care. In the UK, register with a local general practitioner, GP, who serves as the first point of contact. Referrals are needed for specialist care. Waiting times for non-urgent care can be significant. Routine specialist referrals may take weeks or even months. Emergency care is fast and free. There's no financial barrier to seeing a doctor, but capacity constraints mean waiting lists are part of the system, particularly for elective procedures. In the U.S., patients can usually see any provider who accepts their insurance. Referrals may be required depending on the insurance plan, especially HMOs. Wait times for specialist care tend to be shorter than the NHS. Financial barriers exist, but once insurance is in place, patients may enjoy faster access to non-urgent specialist care. 4. Quality of care. Both systems deliver high-quality emergency and acute care. The U.S. leads in access to cutting-edge treatments and diagnostic technologies, but at a high cost. The U.K. ensures universal access and better primary care coverage overall, but faces capacity challenges and pressure on resources. Outcome differences exist but are complex. The U.S. spends far more per capita on healthcare, yet metrics like life expectancy and maternal mortality are worse than in the UK. 5. Life expectancy and health outcomes. UK average life expectancy, around 81 years in 2025. US average life expectancy, around 77 years in 2025. Despite higher spending in the US, outcomes like life expectancy, chronic disease prevalence, and infant mortality are often better in the UK, reflecting differences in access, prevention, and social determinants of health. 6. Role of private health insurance in the UK. Around 10% of UK residents carry private health insurance, usually as a supplement to the NHS, not a replacement. Private insurance in the UK provides quicker access to elective procedures, offers private hospital stays, allows patients to choose specialists or surgeons. But even with private insurance, most critical care emergencies, complex surgeries happen in NHS hospitals. 7. Funding and spending. United States. U.S. healthcare spending exceeds $12,000 per person annually in 2025, the highest in the world. Healthcare accounts for around 18% of GDP. United Kingdom. The UK spends around $4,500 per person annually. Healthcare accounts for about 11% of GDP. In pure financial terms, the US system costs roughly double per person compared to the UK, yet leaves millions uninsured or underinsured. 8. Prescription drugs. Prescription drug costs are dramatically higher in the US than the UK. The UK's National Institute for Health and Care Excellence, NICE, negotiates drug prices nationally, keeping costs controlled. In the US, drug prices are market-driven, with no national price control leading to some of the highest medication costs globally. 9. Mental health and additional services. Both countries struggle with mental health access but approach it differently. In the UK, mental health services are integrated into the NHS, with access through GP referral but subject to waiting times. In the US, mental health coverage depends heavily on insurance. Private insurance plans vary widely in what they cover, and out-of-pocket costs can be substantial. Before we wrap up, let's dig even deeper into some practical aspects that affect individuals in each country. 10. Primary care versus specialist care. United Kingdom. The NHS emphasizes primary care as the gateway to the entire healthcare system. General practitioners, GPs, act as gatekeepers. All non-emergency specialist referrals must go through your GP. Patients typically register with a single GP practice near their home. Continuity of care. Most Britons see the same doctor for years. This system reduces unnecessary specialist visits, controls costs, and focuses on prevention and holistic care. But it can also create bottlenecks and delays when demand outstrips GP appointment availability. United States. Americans can generally access specialists directly. Some insurance plans, especially PPOs, allow direct access. Other plans, like HMOs, require referrals, similar to the UK model. This greater flexibility means faster specialist access for many Americans, but it also contributes to higher costs and greater use of expensive procedures and consultations. 11. Hospital ownership and funding. U.S. hospitals. In the U.S., hospitals can be private, nonprofit, private, for-profit, public, city, county, or state-run, but smaller share. Most hospitals are private entities. Even nonprofits often operate aggressively as businesses, focusing on revenue generation. UK hospitals. Almost all NHS hospitals are publicly owned and operated by NHS trusts. Funding comes primarily from taxation, with budgets set centrally. There's little or no billing infrastructure for patients using the NHS, vastly reducing administrative overhead. Administrative costs account for around 8% of NHS expenditure, but closer to 25%, 30% of U.S. healthcare spending. Another reason why the U.S. system is more expensive overall. 12. Health insurance marketplaces and options. United States. For those without employer-sponsored insurance, individuals must shop for coverage via marketplaces, e.g. healthcare. Gov. Choice comes with complexity. Dozens of plans. Varied networks, deductibles, premiums, co-pays, subsidies available for lower-income individuals but paperwork heavy. Even insured Americans must navigate network restrictions, prior authorizations, and complex billing, all contributing to administrative burden. United Kingdom. No equivalent concept of insurance shopping. UK private health insurance document, private patient in UK clinic, NHS versus Private Health Access UK. Private medical insurance exists but is simple. A minority purchase it for faster or private hospital access. Premiums are lower than in the US because they supplement rather than replace public coverage. The NHS means no one needs to research, compare, or purchase basic health insurance in the UK, dramatically simplifying life for individuals and families. 13. Maternity care differences. In the UK, maternity care is fully covered by the NHS. Care is generally midwife-led, with obstetricians involved only when medically necessary. Women receive prenatal care, delivery, and postnatal care without financial cost. Many maternity units encourage natural childbirth with minimal interventions unless needed. In the U.S., maternity care is a major expense, even with insurance. Costs for childbirth can range from $10,000 to $30,000 before insurance discounts, with significant out-of-pocket costs depending on coverage. U.S. maternity care tends to be more medicalized, with higher rates of interventions like epidurals and C-sections. 14. Mental health and preventive care access. In the UK, mental health services are part of the NHS, but waiting lists can be long for non-urgent therapy. Crisis care is accessible via NHS emergency services. Some employers offer private mental health coverage to supplement NHS services. In the U.S., mental health coverage varies wildly by insurance plan. Out-of-pocket costs can be prohibitive, even for insured individuals, especially for therapy. High-quality care is available, but affordability remains a barrier for many Americans. Both systems face mental health care challenges, but while the NHS guarantees some level of access, U.S. care depends much more on ability to pay or insurance generosity. 15. Healthcare outcomes beyond life expectancy. Other key differences in outcomes worth mentioning. Maternal mortality. US higher rate than most other developed countries, Mighton 17 deaths per 100,000 live births. UK lower, not 7 deaths per 100,000 live births. Infant mortality, US higher rate, 5 deaths per 1,000 live births. UK lower, or 3 deaths per 1,000 live births. These differences reflect not just healthcare system design, but social inequality, access to prenatal care, and support services around birth and early life. 16. Administrative simplicity for the public. In the UK, the simplicity of the NHS means no network checks, no insurance approvals, no billing paperwork, no negotiation with providers. In the US, patients face complex insurance documents, explanation of benefits, EOBs, prior authorizations, navigating in-network versus out-of-network care, managing deductibles and copays. The average Briton interacts far less with healthcare bureaucracy than the average American. Summary. Let's recap the bigger picture after this deep dive. The UK's NHS provides universal, tax-funded, free-at-the-point-of-use healthcare with minimal out-of-pocket costs, central coordination, and administrative simplicity. The US healthcare system is primarily private, expensive, insurance-driven, and complex, requiring active management by individuals, but offering faster elective specialist access for the insured. US spending is dramatically higher, $12,000 SARS per capita versus $5,000. Yet the UK achieves better or similar outcomes in areas like life expectancy, maternal and infant mortality, and primary care coverage. Private health insurance is essential in the US but optional in the UK. Access and equity differ. UK ensures everyone receives healthcare regardless of ability to pay. US offers greater choice and speed for those who can afford it, but struggles with affordability and insurance coverage gaps. That's it for today's deep dive into healthcare systems in the US and UK, fully extended to cover all the nuances and practical realities you need to know. If you found this helpful, subscribe and turn on notifications because we have more detailed comparisons coming soon. From small business loans and tax systems to retirement plans, housing costs, and education. And I want to hear your views. Which healthcare system would you prefer and why? What's your personal experience of navigating healthcare in your country? Drop your thoughts in the comments. I'd love to discuss. Thanks for watching, and I'll see you in the next one.